Hey everybody, so we're here to look at the idea of cardiac output. Okay, and so I want to start off really quickly with a little definition of cardiac output. And so that is the quantity of blood pumped by the heart in 1 minute. Sorry, my handwriting got a little messy there, so it's the quantity of blood pumped by the heart in 1 minute. So we typically measure it in liters per minute. So that makes a lot of sense. It's pretty straightforward. But then we have to stop and think about, well, so if we're talking about the blood pumped by the heart in 1 minute, what else involved in this process? And so we have two key factors, hence our two key boxes. The first one is the heart rate. Which is just simply how many beats per minute. And the other key factor that comes into this is what we call stroke volume. See if I can switch myself a little. There, that's better. Stroke volume. And this is the volume of blood pumped by the ventricles each heartbeat, each beat. So if we take the heart rate and we take the stroke volume and put them in together, we get our cardiac output. And as we said, that's the quantity of blood pumped by the heart in 1 minute, and we measure it in liters per minute. So if we think about that, we can also write it kind of as a mathematical formula, hence the calculator here. So cardiac output, which we represent as CO, cardiac output, equals the heart rate times the stroke volume. So cardiac output equals the heart rate times the stroke volume. So we could, as long as we have two pieces of this formula, we could calculate for whatever's missing. So the idea in and of itself seems pretty easy and pretty straightforward, but you need to understand that heart rate and stroke volume can be affected by lots of different things. So we're going to start with our heart rate and think about what can affect the heart rate. I'm going to tilt the page a little bit for my writing. So first of all, stress is a major effect when it comes to cardiac output in general and heart rate specifically. So stress can play roles in terms of, are we running off of our sympathetic and remember, we have sympathy for anybody who's in that room when the bear walks in, because that's our fight or flight concept. So sympathetic, or are we dealing with parasympathetic? Because those two different systems will affect the way the heart is beating, the rate of the heart, because obviously if a bear walks in the room and we are doing our sympathetic, then our heart rate should increase to make sure that we can get away from the bear. Okay, and then hormones will play a role. So do we have things like epinephrine? Running through our system? Is it high and low? Because we know epinephrine can sometimes speed up our heart rate. What's thyroxine doing? Because remember, we talked about how our thyroid hormones play a big role in terms of our metabolism. And so if we have higher levels of epinephrine and thyroxine, we're going to have a higher heart rate. The ions in our system, we've talked about how important some of the ions are in terms of muscle movement and nerve impulses and things like that. So we need to understand that electrolyte imbalances will impair contraction. And if the heart is not contracting correctly, that affects the heart rate. And then, of course, there can always be physical factors with the heart. Due to age. I mean, the older the heart is, the more issue it's going to have in terms of possibly have, obviously, it varies. Your body temperature. You'll find that your heart rate goes up when your body temperature goes up. And just your overall health, all of these things are going to affect your heart rate. Okay, so those are just a few things that might affect the heart rate. Now let's think about what are some things that might affect the stroke volume, the amount or volume of blood that the ventricles are pumping. And so, of course, one of the things that really does play a role here is exercise. Because when you exercise, you have additional blood returning to the heart, return from the contracting skeletal muscles. So we know that the venous return, not only do we have the new blood that's coming out of the heart pushing on the blood that's already in the vessels, and eventually it's pushing the blood in the veins, but it's not as pushing that much harder. And so we also have the movement of the skeletal muscles that kind of milk along and push the blood in the venules. And so when we're moving, when we're exercising, and we're using those skeletal muscles, that's going to actually increase the amount of blood that's coming back into the heart faster than what would be happening at rest due to the motion of the skeletal muscles. The other big factor that is going to play a role in terms of stroke volume is one that hopefully you'll never have to deal with, but it is known as rapid blood loss. And so obviously you really hope that you never run into a situation where your blood volume is going to decrease quickly. So decrease the blood returning to the heart. And so obviously this is typically in relation to some sort of catastrophic event. You could have had something that maybe has punctured the body in such a way that blood is leaving it very, very quickly. You could have been in some sort of accident that has damaged the system, gunshot wounds, knives, basically anything that can cause a sudden drop in the amount of blood that's in the body will decrease the amount of blood returning to the heart and therefore change the stroke volume. And so, like I said, that's one that hopefully you don't ever have to deal with, but it is one to know about. So hopefully this helps you a little bit when it comes to the concept of cardiac output.